Compounded GLP-1s are not FDA approved in the same way that the original versions were. So that means patients are exposed to real and preventable safety risks. We've already seen the impact in that patients using a compounded GLP-1 are twice as likely to be hospitalized due to a multitude of reasons. So we advocate for patients to seek out care with a trusted clinician who can care for them for the long haul for the disease of obesity. Well, obesity is the most common chronic disease in America, but outdated insurance coverage policies mean that too many people can't afford FDA-approved treatments. So we're advocating that more and more insurance, as you may have seen last week, Medicare is now able to cover these medications under special provisions. And now that Medicare is covering them, we think that should open up access to all Americans to have coverage for medication for this chronic disease. Well, we believe that large-scale compounding of GLP-1s isn't needed anymore. We should put regulations in place that prevent that, that put patient safety above commercialism. And frankly, a lot of these patients with obesity are being taken advantage of by some of the predatory practices online where it appears that you're getting the same medication as what is approved by the FDA, when in fact you are not. We want patient safety and health outcomes in the long run to be the goal. Well, the first thing to do is find a clinician who's going to care for you over the long run. This is a chronic disease of obesity. You need someone who's going to look after you and care for you and understand the risk and benefit of all treatments options that we have. Getting an FDA-approved medication from the pharmacy is one way to ensure that. There are multiple ways nowadays. There's going to be newer medications coming out over the next year that are going to be much more affordable. So we're hoping for much broader coverage for all Americans so that we can really tackle this disease head on. Yeah, the most important place that you can go to get more information would be the Obesity Action Coalition. It is our patient advocacy arm for people living with obesity across the country. That's www.obesityaction.org. And again, find a clinician who can care for you. I'm the current Chief Medical Officer of KnownWell. We take care of patients virtually across the country, covered by their insurance, and find someone who can care for you in the long run for this disease.